y'all doing? So I'm going to talk to you guys about the importance of being established with a primary care provider. I've been a primary care provider for about 2.5 years now, and I like to tell my patients that I am their best friend in healthcare. So I know everything about you, we talk about anything, and I want you to feel comfortable and safe with me. I'm going to touch on just about 5 things that I think that I want you guys to know on how you can benefit from having a primary care provider. Number 1 is continuity. So you want to have one healthcare provider that knows, like I said, everything about you. That way, if anything were to come up, I can tell you how to navigate through that situation. I can refer you to a specialist if I need to. And if there is an emergency, I am going to be the foundation to get you the help that you may need. Number 2 is convenience. Within a primary care practice, you can access a variety of things, such as at neighborhood where I work, we have primary care, we have pediatrics, we have dental, we have mental health, we have obstetrics, and we have gynecology. So if you're an established patient with me, if I need to refer you out to a practice or a specialty within the practice, I can do that. The third one is health maintenance. I am very, very big on preventative health. I always encourage my patients, if there is something that we can prevent, if there is something that we can stop from happening, let's do it. So if we need to focus on nutrition, if we need to focus on lifestyle changes, I want to encourage all of my women to get their mammograms, pap smears, all of my guys to just come in and get those yearly physicals so that we can get those yearly labs done. That is very, very essential. I've had countless situations where we have detected breast cancer at a very early stage. Our patient went and got a colonoscopy, and they were able to remove precancerous polyps. So that is very, very important. The last thing is better communication. I think communication is essential, and when I talk about communication, I'm going to talk about, I think that sometimes patients really don't know how to be patients. I think that's something that kind of has to be taught. So when you go to your primary care provider or any doctor, I want you guys to know your history. So if you have something that's going on with you, keep a journal. Write down your symptoms, write down what happens, write down what medications have worked for you, what medications haven't worked for you. Make sure you know your family history. Make sure you know your surgical history. If you're on medications, what I like to do is I like to give my patients a list of all of their medications, and I write next to it what that medication is for, so that if there is ever any question, you have a list and you know what's going on. I want you guys to be able to advocate for yourselves, and nobody knows you better than you know yourself. Always ask questions. So if I explain something to my patient and they are not able to explain it back to me in layman's terms, we go over it again. So if a healthcare provider, whether it be a primary care specialist or whether it is a specialist, a cardiologist, a pulmonologist, if they're telling you what your plan of care is and how they plan on making you better, and you don't understand it, say, hey, can we break that down? Bring it down, because a lot of the times doctors will come in and throw a lot of medical words at you, and you don't have a clue what they're talking about. Say, can we go over that again? And the last thing is, make sure that you are coming to your wellness visit. So your wellness visit is going to be 1 visit a year where we just make sure that you're okay. So that way, if a problem comes up, you can schedule a problem visit and we can focus on that one thing. So that way we know that you are getting the best quality of care. And if you're getting good quality care, it's going to definitely improve your overall quality of life. Thank you.